All right, hello. I am going to do a few practice questions that were asked. For this video, it will be on input-output questions, as well as looking at some reconstitution type questions. So with the input-output, this is the basic way that these questions will be asked. You'll be given a certain amount of volume lost and the subsequent replacement volume associated with that. And then you'll be given what the patient has actually lost output wise, what they've actually voided. And then you're going to calculate the volume for that. So for this question, it says for every 120 milliliters of urine output, replace with 30 milliliters of water via the PEG tubing every 3 hours. If the urine output for the last 3 hours is 200 milliliters, the fluid replacement volume would be what? So let me show you how I would set these up. Share and get my video here. All right, so for this question, as I mentioned before, it says for every 120 milliliters urine output, replace with 30 milliliters. Now, I came up with an equation that's basically based off of using ratio proportion, some elements of dimensional analysis. You can use dimensional analysis to answer this question. The simple way that or at least simple to me, and again, this is for like our IO input output type problems. What I have found that seems to be helpful is I take a little formula that I created that just says the actual out over, let's just say the expected out times the replacement. Okay. And when I do that, that will help me to calculate how much I need to replace. So the way for this problem where it says for every 120 milliliters urine output, replace with 30 milliliters, and then the actual output was 200, I would set this up like this: 200 milliliters over 120 milliliters times my replacement volume of 30 milliliters. Okay. Then I would plug that into my calculator. I would take 200 times 30 and then divide by 120, and I'll get an answer of 50 milliliters for my replacement volume. Okay. Now, this question could be worded differently. It might be worded, the patient in the last 4 hours, the patient lost 500 milliliters. What would the fluid replacement volume be if we're supposed to replace with 200 milliliters for every, or replace with 40 milliliters for every 200 milliliters lost? Okay. So I kind of changed up the variables a little bit. All right. So in this new scenario, I said, so let's just go with let's just say the expected out was 200. The replacement volume was 50. Okay. And then I said the actual output was 500. So I'm going to use my same basic setup that I did here and just kind of work this into a problem. 500 milliliters over 200 milliliters. So my actual output over my expected output times the replacement volume of 50 milliliters. And then again, when I do that, I'm going to take 50 times 500 and then divide that by 200. And my replacement volume for this situation would be 125 milliliters. Okay. So that's a basic input output type question. And what will be tricky is just the way that they kind of word it. When I reworded the question just verbally, obviously I put the actual output first, then the replacement volume second, and then the actual or the expected output third. I just changed the order, but you would still follow the same basic premise of actual over expected times the replacement. And that should help you out with these input output type questions. The next question was on a reconstitution question. There's a couple of these that I can pull up. I'm going to pull up this one here. So let me open this up for you so you can see what I see. So this is showing question 18, order Pfizer pen, 375,000 units, intramuscular stat every 6 hours. Using the information below, choose the strongest concentration and then determine how many milliliters you will administer to the patient. Now there's some extra information in here, okay? The extra information is what is listed in the milliliters diluent added. That just tells the pharmacy how much water to add to the powder to get to these concentrations, okay? And then when it says to choose the strongest concentration, then we look at our units per milliliter. 250,000, 500,000, 1 million units is the strongest concentration. So that's 1 million units per milliliter. So when you solve this, all you're going to do is take that 375,000 divided by 1 million, and that's how you solve this problem. So the trick with these is just knowing to eliminate the milliliters diluent added. And then once you do that, you should be able to set that up. Now, when you do this question, you're going to get 0.375 milliliters as your how much you're going to administer. And then sometimes, depending on what your program suggests as far as rounding is concerned, and also dependent on what type of syringe you have available, but for the classes that I typically work with, we're going to go ahead and round that to 0.38 milliliters. But if you had a syringe that measured down to the thousandths place, then you'd be fine with giving and administering 0.375 milliliters. And keep in mind that a typical rounding rule that's helpful is for a number that's less than 1, round to the nearest hundredth place, and for a number that's greater than 1, round to the nearest tenths place. So that's where the 3 would be. But this number is less than 1, so that's why we don't round it. I have another example of an infusion rate. So let me stop this here and let me, not infusion rate, I'm sorry, of a reconstitution question, or at least it has the word reconstitution in it, but it doesn't necessarily mean that it is a reconstitution question. I'll show you what I mean in just a second. Let's see if I can pull this up. Give me 1 second. Okay, so let me share this real quick. Okay, so for this question, this says it's a reconstitution type of question. It says the directions for reconstitution of meslocillin IV injection reads, quote, for IV use, reconstitute with 30 milliliters sterile water for injection. Each 30 milliliters of reconstituted solution will contain 3 grams of meslocillin. The patient client is to receive 1.5 grams of meslocillin IV every 6 hours. How many milliliters will the nurse administer? So we're going to set this up using some information here. And there's actually extra information in this problem, which is good to know, because then we at least, you can see this where there's extra stuff that we don't necessarily need. So it tells us that for each 30 milliliters of reconstituted solution, it will contain 3 grams of melloxylin. So what I'm going to do is I'm going to create a ratio, or not a ratio, but I'm going to just write that down, and I'll pull up my screen here in just a second. But 3 grams for every 30 milliliters. Okay. And then the order. Okay. So this is actually what I have available. My order is going to be the 1.5 grams. So if you're looking at this, you would say right off the bat, you would say, well, 1.5 grams is half of 3 grams. So I'm going to give this person 15 milliliters, which is the correct answer. That's how you would set that up. But if you didn't know that already, let's see how we can do that. So let me switch back over, and you can see what I did is I wrote the order 1.5 grams. The available is 3 grams per 30 milliliters. Now you can reduce this if you want to, but we're just going to keep it as it is. And what I'm going to do is I'm going to use some dimensional analysis to solve this problem. My order is 1.5 grams. Okay. But I don't want 1.5, or I don't want grams. I want milliliters. I want to get rid of grams. So 3 grams goes down here. 30 milliliters goes up here. And then when I set this up and I plug it into my calculator, I'm going to do 1.5 times 30, which equals 45, divided by 3, which will equal 15 mLs. Okay. So that's how you'd set up that particular question. Now I'm going to pull up the question again. So you'll see here that it says every 6 hours. The question didn't ask anything about time. Okay. So that's why I'm not even looking at the time. It's just telling us when to give them that injection. So a lot of times students get hung up on reconstitution because you're looking for more to do, but all what you need to know is how many grams or milligrams per milliliter in order to solve the equation, and then have something to compare it to. So most reconstitutions are going to be good examples like this one here. The meslocillin is that it's some sort of antibiotic. And so when you have an antibiotic type of question, then you're going to see, or when you have an antibiotic typically, and if it's not in a pill form, it's going to be a reconstitution where pharmacy adds some water, sterile water, as you can see there. And then it's either going to be an injection or it's going to be consumed, swallowed per oral in that respect. So, okay. So hopefully that's helpful for you. And as always, if you have questions, please just let me know. And anyways, I'm going to go ahead and end this video here, and I'll talk to you next time.